I invite the last speaker of the day, Dr. Jennifer Prabhu, to tell you a little bit about her. She's a co-founder and CEO of Circee Health Private Limited. She's double board certified in MD Pediatrics as well as MD Internal Medicine. She's a member of Physicians Committee for Responsible Medicine. She's also been a finalist in Shark Tank India Season 1 Sony TV, winner of Young Entrepreneurs Award by Eating Health World, permanently registered to practice in India and US. And she's also been awarded with various awards and honors. For example, the Outstanding Primary Care Physician. There are many more achievements, but I'll ask her to start her talk.
Good evening, everyone. So I think many of the things I'm about to say have been mentioned already, so hopefully not too repetitive, but maybe I can give some additional fun facts as well. So I'm going to be focusing on specific ingredients, probably that most of you can find in your kitchen, and the health benefits associated with them. Okay, so again, I think this has been mentioned already by many of the speakers, but I like to classify, to kind of simplify human disease in one of two categories, or both actually. So inflammation, we've heard a lot about already today. So examples of inflammation causing disease, inflammation in the brain causing Alzheimer's disease, inflammation in the gut causing Crohn's disease or inflammatory bowel disease, inflammation in the lungs causing asthma, COPD. And then you look at imbalances, whether it's imbalances in the gut microbiome causing many diseases that we've heard, imbalance in hormones causing diabetes, imbalance in chemicals in the brain causing psychiatric illness like depression. So the answer up until fairly recently to all of these diseases is take this pill or take this injection. But now we're hearing more and more from scientists and doctors and research that just eat more plants, eat more plant-based foods, eat a mostly whole food plant-based diet, and it's amazing what can happen. So, I'm sure, or hopefully a lot of you have heard of the blue zones where, 90% of their diet is plant-based. They're living to 80, 90, 100 years old. So there's got to be something, and that's been going on for hundreds, thousands of years. So we're going to talk about superfoods today. And what exactly is a superfood? Basically, a superfood, which is a key phrase that everyone has heard of, it's one particular ingredient that can cause a multitude of health benefits. So it has multiple vitamins, multiple nutrients, and you just need a small amount to prevent and treat diseases. So why should you try to incorporate them into your diet? Hopefully I'll give you some examples. There we go. Okay. So I wanted to start with one of my favorite foods, dark chocolate, specifically dark. So dark chocolate means there's no milk solids, there's no dairy, and it has a high concentration of cacao, which is the natural form of chocolate. So that's very important to differentiate. What makes chocolate so impressive is all the antioxidants that it contains. And the most important one is something called flavonols. So flavonols are one of the most powerful antioxidants that we know of. Basically, what it does is it increases production of nitric oxide, which relaxes your blood vessels. So that causes lower blood pressure. It also causes lower incidence of heart disease, and it also improves blood flow to the rest of your body. So it's a very, very powerful substance. Also, dark chocolate has lots of minerals. Again, it's a superfood, so it's concentrated within one small little square of dark chocolate. You're getting iron, you're getting magnesium, which helps with mood. You're getting zinc, which helps with immunity, and you're getting phosphorus, which actually helps strengthen bones. And this is something I actually didn't know, but chocolate is actually high in fiber. You take, I guess, 1 or 2 squares, about 30 grams, and you get 4 grams of fiber, which is about 20% of your daily requirement of fiber per day. So that's actually, eating chocolate, don't think about it as a high fiber food, but surprisingly it is. The antioxidants I mentioned, there's one in particular called polyphenol. So of course, chocolate tastes good and that makes everyone happy, but it actually is making you happy because of this polyphenol antioxidant. Multiple studies have shown people that have at least one serving of dark chocolate per day are overall happier and less incidence of depression. All right, so we just heard about berries. So berries are powerful for preventing cancer and preventing the progression of cancer, but they're also very important for blood sugar. So berries actually directly increase insulin sensitivity. So the opposite of insulin sensitivity is insulin resistance, and that is the cause of type 2 diabetes. So the more berries you have, the higher the more sensitive to insulin your tissues are, and there's less blood sugar floating around in your body. So it's good for patients with diabetes or patients with pre-diabetes. Sorry, Sorry, I'm getting over a cold in my mouth. Sorry about that. Okay. So again, I think this was mentioned, but another thing that makes berries so special is that they have a very high fiber content, and actually the highest fiber content of all fruits. Fiber is one of my favorite things to talk about, and I will not bore you with my hours talking about fiber, but basically the two most important things that fiber does is, one, it slows down how fast food goes through your digestive tract. So it makes you feel full longer. And the second thing that it does is it acts like a broom. So when fiber is going through your intestines, think of it as taking all the bad things with it. It takes fat, it takes chemicals, it takes bad hormones with it, and it exits your body at the end of the day. Also, berries have been shown to directly lower cholesterol, particularly LDL cholesterol, which is the bad cholesterol. And there's one study, it was over 8 weeks, adults with metabolic syndrome. So not quite diabetes, but they're obese. They have high blood sugar, high cholesterol. Only 8 weeks, they had a beverage made from freeze-dried strawberries once a day, and they had an 11% drop in their LDL cholesterol, which is comparable to some of the cholesterol-lowering medications that we use. So that's pretty impressive. Also, all berries, but particularly amla, which is not in my picture, are high in vitamin C. And vitamin C is excellent for your immune system. And then finally, berries are also good for your skin. They actually have a component that protects the collagen in your skin, and collagen is what keeps your skin firm and young looking. Thank you. Okay, so leafy greens, spinach, maybe, kale, mustard greens, broccoli greens. One of the healthiest things we can eat by far, and I probably could have listed 5 or 6 other points on here just because there's such an amazing superfood. But one of the more interesting things is how it directly affects your cognition meaning your thinking and your reasoning. So having one serving, which is 2 cups of raw leafy greens a day, is very protective against Alzheimer's disease and cognitive decline. And one study showed they compared people that ate the leafy greens versus those that had less than the recommended amount. And the people that ate the leafy greens actually had a cognitive age 11 years younger than their counterparts, which is pretty interesting. Also, it's good for bloating. So unfortunately, most of our diets contain a lot of sodium. Sodium makes your body hold on to water, which causes bloating, particularly abdominal bloating. But leafy greens have a lot of potassium. Potassium and sodium are kind of opposites. So that makes your body get rid and diurese the water. So you pee it out and you're not as bloated anymore. Also, leafy greens have lots of vitamin K, lots of calcium. You do not need to have dairy to have calcium. You can have a ton of leafy greens. You get better calcium too. So plant-based calcium is a lot better absorbed and better recognized by your body than calcium coming from animal sources. It's protective against your gut. It actually directly strengthens the lining of your gut. And as we heard before, the gut microbiome is so important, not just for your gut health, but for your overall health too. And finally, I think I made up this word. It's anti-autoimmune. So let's find myself here. So yes, so the reason why it's prevents autoimmune disease is because there's so much vitamin D in leafy greens, and vitamin D, as I think we learned even more through COVID, is very important for our immunity. So high vitamin D actually strengthens the T cells, which protects us against viruses, bacteria, etc. Soy. So my husband mentioned I talk about soy. Soy is one of my very favorite foods, and I get very passionate when people say that soy is bad for you. So soy is not dangerous. There have been many myths disproven more recently that soy is actually one of the best foods you can eat. I always use the example, if soy is so terrible for you and causes cancer and makes men look like women, etc., then I mean, look at China and Japan, and they're all thin and less risk, less incidence of cancer, less incidence of heart disease. The men don't all look like women. So soy is not dangerous. One of the great things about it is an excellent source of protein, one of the best sources of plant-based protein. And then you add in the fact that it also has fiber, so it's a great combination. And it actually reduces the risk of certain cancers, as we just heard. So not only reduces the risk of breast cancer, which is the opposite of what everyone hears, but also prostate, lung, endometrial, ovarian, and the list goes on. I think they're finding more and more. Also, because soy has those phytoestrogens, which are the safe estrogens that our body recognizes when menopause happens and women have to suffer with mood changes and hot flashes, taking in soy produces significantly less menopause symptoms. There's a study in Japan that looked like a retrospective study looking back, and it said compared to with Western populations that have less soy, the women in Japan had 37% less menopause symptoms. And And similar similar numbers with osteoporosis. Again, looking at the East Asian countries of China and Japan, there's around, again, 33% reduced risk of osteoporosis because of it ended up being because of the amount of soy that they consume daily. I believe the serving size is 1 cup of tofu or 1.5 cups of edamame, or the soybeans. Thank you. So again, more praise for fermented foods, which in India we're very lucky to have a lot of. So just kind of a reminder of what is fermentation. It's actually an ancient technique for preserving food. So the food is allowed to accumulate various bacteria, fungi, yeast, and they use the natural sugars in the food to create alcohols and acids. And that the alcohol and the acid is what actually preserves the food. Been around for thousands of years, so it must mean something, right? Most important thing about the fermented food is they're natural probiotics. So all those good bacteria, the bacteria that our gut needs to stay balanced, is given directly. So you eat it directly from the food and it lives in your gut, as opposed to prebiotics, which take a little longer to work but are also important. Another thing that's interesting about fermented foods is, I think someone mentioned about the anti-nutrients. So that is like the skin on some nuts and the skin on some beans, which don't allow it to be digested properly or absorbed properly because of kind of this coating. But fermented foods, the bacteria in these foods break that down, and then you can more easily absorb the nutrients, certain vitamins, B vitamins in particular, I believe. It's a powerful anti-inflammatory, again, related to the gut microbiome and gut health. And then finally, we talked a lot about antibiotics. So if you have to take antibiotics for the correct reason, having fermented foods is we recommend that all the time, not just probiotic pills, but fermented foods in particular. So nuts and seeds, again, we heard a lot about these, particularly walnuts are the highest source of something called omega-3 fatty acids, which are so important for cardiovascular health, for brain health, for blood pressure, et cetera. Probably, we hear, at least in the Western world, everyone talks about fish oil and eating fatty fish to get your omega-3s, but you can actually, your body more efficiently absorb the omega-3s from plant-based foods, and nuts and seeds are the best source of that. It's a great snack, again, a handful a day, very satiating because of the high fiber and high protein, does not spike up your blood sugar. So excellent for those with prediabetes and diabetes, and for anyone, honestly. Has lots of unsaturated, which are the good fats. So it's not going to affect your LDL, the bad cholesterol. It's not going to cause atherosclerosis. And then again, tons and tons of different vitamins and minerals, particularly vitamin E. So it's another difficult to find vitamin E in plant-based food, but nuts and seeds do have that. Right. So just ending with spices, which is my favorite category. Again, we've heard a lot about turmeric or haldi, I believe one of the most powerful anti-inflammatories in terms of food, or as opposed to medication. So it's been shown in many studies, particularly in arthritis, to reduce pain related to arthritis, osteoarthritis. Also been shown to improve symptoms of depression, anxiety, which again is brain inflammation. And then the doctor before me was talking about cancer. I believe there are actually some not using it only to treat cancer, but as an adjunct. So taking chemotherapy alone versus chemotherapy and curcumin, which is the chemical component, the important chemical component of turmeric, had a much better response than just plain chemotherapy alone. So it definitely has promise for the future. Cinnamon, again, good for blood sugar. It has a sweet taste without actually having any glucose in it. And it's also an anti-inflammatory as well. Garlic directly improves blood flow and softens the arteries. So it is the opposite of plaque forming, which is good for blood pressure, good for your heart, good for preventing stroke. Cayenne pepper contains capsaicin, which a lot of doctors are using instead of NSAIDs, instead of ibuprofen for pain relief, and no side effects. Cardamom, I think, has been used in India for a long time to freshen breath, and that's because it actually attacks the bad mouth bacteria that causes bad breath, and it also helps with gingivitis, which is inflammation of the gums. Something interesting that I learned about tulsi, it actually directly acts on two groups of immune cells. It makes their numbers become larger. So natural killer cells and the T helper cells, which are like the first line of defense against bacteria and viruses. So specifically increases those numbers, which is really amazing to me. Ginger has been used for a long time as a natural relief for nausea in pregnant women, but also even in patients receiving chemotherapy. And it's also a strong anti-inflammatory. And then methi or fenugreek is, again, good for patients with diabetes. It actually improves insulin sensitivity, again, similar to many of the other ones I just talked about. Right, I think that's the last one. So we try to practice what we preach about this, really before jumping to pills and crazy fad diets, just gradually changing over to a more plant-based, a more whole food plant-based diet can have incredible results. So hopefully this will become more of a theme as the years go.
Thank you, Dr. Jennifer. Can I have all the speakers on the stage, please, for the panel discussion? Dr. Jennifer, I have a question for you.
Oh, sure, yes.
Yes, ma'am. You spoke immensely about the health benefits of soy, right? And you also highlighted that people in China and Japan, they have reduced risk of many health issues thanks to the soy consumption. Uh, I've heard some of the doctors say that soy triggers the thyroid damages, or rather triggers the thyroid issue. So your study and thoughts on that?
So I believe that's fairly controversial. I have plenty of patients, including my own mother, who swears by soy. She used it for her menopause symptoms, and she had hypothyroidism for many years. Never affected her thyroid function. Didn't make sense. So like my husband, I tried to look for. I couldn't find honestly any, because I came across that in my research for this. I couldn't find any like clear-cut evidence that soy truly affects the thyroid. And now I would say exogenous estrogens, like hormone replacement therapy, you have to be careful about. But natural phytoestrogens, as far as I've read. Am I correct?
Yeah, there's no clear studies that talk about any of these components affecting. So
At least that we
Because some of the doctors here in India, they have thoughts that soy is controversial and so is groundnut. So both of these.
I think so. It's very much.
we're very data based. I mean, we work on basically looking at clinical trials, saying, okay, you have 500 patients this way, 500 patients that way. 500 patients were given soy, 500 patients were not given for soy. And you show that the 500 patients that were given soy had adverse effects, then I believe it. If not, then I'm not going to believe it. And that's just the way science works. So I don't have anything else to say about the doctors that, say something. Maybe it might be best to ask for evidence from them, saying, do you have any peer-reviewed data that says this?
Thank you.
Second, we can go back to history here in the blue zones.
Yes, absolutely.
People in Okinawa, they use more soya and sweet potatoes, as you rightly mentioned. They've been living longer.
Which part of the world is this?
Okinawa, Japan.
Okinawa. Yeah, I can say a personal example. So we have two sons, and So we have two sons, 10 and 5, who have both, except for the older one, have been vegan since birth, basically. And they get their milk every morning is soy milk, their milk before school. And I'm a pediatrician too, so I can tell you their development is normal. They are not becoming feminine. They don't have any thyroid issues. So if nothing else, this pediatrician trusts soy for my own reason.
That's encouraging.
And actually, I forgot to say it in my talk, but they show if you start soy, if you incorporate it into a diet earlier, so during the years when breast development begins, then the risk of breast cancer later on, men and women, is significantly lower. So it's important to start it early.
But you also did say if you are diagnosed with breast cancer, then you don't have soy because it's...
Well, that's also controversial, I believe. So a couple of years ago, I would have said no. But for a particular type of breast cancer, estrogen receptor positive, so there's different, different types of breast cancer. But I believe now, and correct me if I'm wrong, that that's been disproven. So it's fine. So you can have your tofu and everything. It should be fine. And I think someone mentioned too, I mean, I'd much rather you have soy than milk if you have breast cancer, like 100 times more.
Coming to your chocolate also, are you saying 80% dark, 90% dark?
I believe it's 85%. I think that was the number. But again, if it's dark chocolate without milk, even if you cannot find the 85, you're still getting some of the benefits. Because I think it's probably difficult to find that everywhere. And it's bitter too.
Amul has 99%.
That's very bitter.
Does it?
80%. That's what I have. 80%. 99%. One of that is opposite. So that's 80% perfect. Very free.
So how to consume soya? Soap, sprouts,
Whichever.
Yeah, however you can get it. We tell people, I mean, we don't want people avoiding foods because it's too fancy for them. So, I mean, soy milk is, of course, more processed. The best way is the more whole foods. So edamame, which are the soybeans, just regular soybeans soaked and sprouted would be great because then you get the fermentation part also. Tofu is semi-processed. Tempeh is less processed than tofu, which is more difficult to find here, but is one of my favorite protein sources. Miso.
Can I give you some idea? So a couple of them. So we also make a lot like tofu burji. You can make tofu burji. If you guys are people who used to eat eggs, they might actually appreciate that. Another one is we take just the tofu and just crumble it up and put some soy sauce, put some ketchup and stuff like that, and just and some more spices, whatever spices you like. Put it on the tawa, make it a little bit more crumbly. Our kids love it. They call it bacon, even though they have never eaten bacon in their life. They call it bacon, but it's very tasty, because you can put it on their rice just plain without dal or anything, or pasta. You put it on that and they love it. So, as long as it has some, something umami, like soy sauce or something.
It's important to flavor tofu.
Yes,
People
yes.
are very averse to tofu if they've had it plain because it doesn't taste very good, but it absorbs flavor really well. So I think it's a good intro into like vegan world for non-vegans. So you can give them good choice.
Especially the Indian tofu has that crumbliness. It absorbs the masalas.
tofu is available outside. Soy tofu is
Yeah,
So
absolutely.
same
Big basket.
Yeah.
They call it soya paneer in India.
Yes.
Soya paneer, yeah.
And it's not very expensive. I think 200 grams is maybe 70 rupees or something.
Yeah. On the store number 68, it's available for much in store.
All these things you can try out.
Yes, 180 rupees a kilo.
So in one of the slides I saw, Dr. Ornish mentions, I don't know who had shown that slide about avocados. He's against avocados. And
In Ornish is not against that.
He
He
Not-
advocates.
he advocates.
He advocates. He's not against.
Yeah, healthy fats.
Doctor, I have a question. Very dark chocolates cause migraines. I think.
It can be a trigger for some people. Yeah.
Yeah, because personally, I'm the victim of that. Though I love dark chocolates, I reduce the quantity of percentage. But if it's 85-75% dark, I get to know that I'm going to get a migraine. Aura and then a one side.
I mean, if you can't tolerate chocolate, then just get your antioxidants from berries or nuts or something. That's fine. I get migraines too, so I wouldn't want you to suffer with that.
Yeah, varies patient to patient. Do you recommend soaking all nuts and seeds for a few hours?
We don't.
We don't.
Maybe because we're lazy,
don't,
but
I'm sure some others might
I
say
think-
that it's soaking it.
it would help with that. Yeah, it's absorbed better. But then if you have non-soaked foods with fermented foods, then the good bacteria will help break down that layer that you need to kind of get through to get to the vitamins and the nutrients. But I think in an ideal world, yes, you would soak them.
What about sprouts? Better eaten raw or sauteed?
Just eat them. It doesn't matter. It's raw is fantastic, and a lot of times, we have some excess sprouts left. We just throw it in whatever we are making, even if it's dal and chawal. I just dump the sprouts in the dal. It's okay. Just consume it.
Cooked is also, if
Yeah.
cooking pressure cooker, it's okay.
Yeah, it's better than throwing it. Because it costs nothing, nothing sprouts. So.
Also, in one of the slides, there was a plate of food, which had salad mixed with the cooked food. So, it's your food.
It's my food. My food.
Yes.
Okay.
So we've always been told the raw component should be had before the cook.
Well, I don't think it is described in allopathy. This is more of Ayurvedic people say. I don't know the rationale behind that.
The digestion time is different between raw and cooked, so it kind of creates havoc with the digestion.
I haven't had a problem so far. I've been following this for more than 3 years. This sort of thing ever since COVID came. So
Also, somebody said to put a little pomegranate seeds. I think it was you who said in your smoothie. So they generally say in a smoothie, don't add any fruit, just your whatever, your one fruit, your banana and your greens.
So again, the idea behind adding pomegranate there is that you cannot just swallow it, that chew it. You have to chew. Okay. And pomegranate itself also had that nitrates. Okay. So now your nitric oxide dose is doubled. Okay. And if we go too much into these things, we will only eat the whole day. We will not do anything else. It's raw food first and then give time for digestion. Then. So the idea is not to complex things a lot, not to complicate things a lot. Keep it simple so that you follow it. Rather than otherwise you will do it for as a fad, and then after a few days you just forget. The past one is fine. Okay, whatever we were doing since the past 30, 40, 50 years, we will do the same thing. So keep it simple, consume more whole foods. Okay. Cancer. I spoke a lot about cancer. I did not speak anything about the negative aspects of milk or non-vegetarian foods. Because again, the idea is not to concentrate on the negatives. Okay. You concentrate on the positives, include more of vegetables, automatically your non-veg could be bonus. If I keep telling them this is bad, they will just get repelled from my suggestions and advices. Yeah. They will say this doctor is bad.
just to reinforce that, you have to eat it in some form. That's the most important thing. Okay. And eating one single fruit or vegetable is not going to make wonders. It's what you eat along with that. Okay. For example, adding a pomegranate to your smoothie, which is healthy otherwise also, is far, far better than adding your same pomegranates to your curd rice. Though it looks pretty attractive.
Many people do it as a decoration.
Yeah, it looks attractive. Okay. So I don't focus on one single item. Look it as a whole.
Also, do you have a recommendation for increasing the WBC other than greens? I think what you meant to say was eating a whole lot of greens. That's a sure shot way of increasing your WBC. Anything else?
Normally, we all have enough WBCs. Okay. They are all the warriors present inside our body. Okay. And we have enough warriors. In normal picture, the WBC increases when there is an infection. That is a sign of infection, right? So, and there also it is getting increased because the body wants more warriors outside from the bone marrow going into the circulation, right? So, we should concentrate on keeping things in normal range. If they are in the normal range, between 4,000 to 11,000, whatever your lab range is, why do we want to increase it?
I had a
We should
relation,
concentrate.
of mine who did a chemo treatment, and the WBC has been down for 8-9 years after the chemo treatment.
How far down is it?
About 4,000,
4,000 is
3,8
fine.
to 4.
That is fine. That is low normal. Okay. So that is absolutely fine. That is why the range is big, and we need to concentrate on the range. What we can do is, it is not the WBCs which help against the cancer. It is the natural killer cells, and it is the CD8 T cells. And we saw how to increase those or how to boost their activities. So concentrate more on that, and don't become too serious when on these food habits when you are actually having cancer, because your body is just overwhelmed with the disease. Okay, go for the treatment, and once you are okay with the treatment, then you start following all these things to prevent the recurrence from happening. When you are harboring an active disease, there might be people who get overwhelmed with these ideas and they tell, okay, I'm not going for surgery, no chemotherapy, no radiation, because it causes more side effects. Yes, side effects are there. If there is an effect, there will be a side effect. It is only because these side effects are studied, these are given in the books. At other places, it might not have been studied at all. Right? So don't concentrate more on increasing WBCs in the normal life.
All numbers are to be interpreted in the context of a given person. It's not. Suppose if somebody is having a fever, somebody is having a bleeding, then certain numbers matter. Somebody has been having one number of 4,000 not decreasing for ages. I don't think we need to give so much of importance.
I think it came into play during COVID, where she was afraid to go out because of that limit.
One more thing to add about WBC levels. Most vegans have a lower than normal WBC count, like between 3,000 to 4,000, including mine when I checked it a couple of times. And the reason is that it's an anti-inflammatory diet. And when you have animal foods in your diet, you have a lot of endotoxins and a lot of inflammation. Even the other test called CRP, that is a test for inflammation in the body, is the lowest in vegans, and it's higher in people who consume animal products. Yeah.
Vegan means you don't allow ghee also.
Yeah. Ghee is not plant-based.
100% plant-based. If it comes from an animal, then it's not plant-based.
So oil is allowed.
Oil is also actually inflammatory. It may be plant-based, but it's inflammatory because it's processed and it's omega-6, mostly omega-6.
So you can have cold pressed oils.
I think from whatever I have understood, cold pressed oil could be okay. Maybe mustard oil, maybe a little bit of olive oil. It should not be heated. It should be very, very minimal. It's better to have the whole plant food which has the fat in it. It has got everything.
So
I don't think oil is at all necessary in the diet. If you really want to have good health, you should.
So there are two different aspects. Vegan is what you are asking is a little different. Vegan is just you exclude animal products. There is a lot of junk vegan food also which is available. Yeah. So I mean, what we are talking of is whole foods plant-based diet, which is slightly different from a general vegan term. And what mostly is getting popularized everywhere is the vegan food. So you get vegan cheese, and if you go to the stalls, you will get everything. That is more to satisfy your taste buds, right? But we need to develop the taste for something like whole food based. So initially there will be some challenge, but like everything else, habits can be changed very easily. Just have to give it some time.
One of the things that I say, I'm sorry. One of the things that I always say is, can you see the plant in your thali? Yes or no? If you cannot see the plant, then it's like maida or something. Then you cannot see the plant. Try not to have that. It's very simple definition. You should be able to see the seed. You should be able to see the grain, or leaf, or fruit, or whatever.
So vegans are vegans because of ethical reasons. That they don't want to harm animals. When we say whole food plant-based diet, it is like there are enough studies show that it is more healthy. It prevents those chronic lifestyle diseases. And the recommendation there is that you have at least 85% of food calories every day coming from whole foods. Okay. Remainder 15% initially can be coming from anywhere. And slowly you come closer to, if it doesn't work, the 85% doesn't work, then increase it. Don't say that it is not working, it is useless. Okay. It is the dose and the effect relationship there. Okay. And coming to the cold pressed oil, it is said that oil is not to be consumed at all. And a lot of Indians will just shy away there only. No oil, okay, fine, I'm not there. Okay. So, coming to the question of cold pressed versus your refined oil, the oil, when it is refined, it is already heated to a high temperature twice before it comes to the shelf on the store. Okay. And we don't have those fried foods in the telas because it is reheated. Imagine here, the oil is already reheated twice. Okay. And what happens when we heat the oil is there are production of trans fats. Without going into the details of the biochemistry here, trans fat has been labeled as not acceptable by WHO right from 2016 or 2018, somewhere there. Okay. They have clearly labeled it that trans fat is not acceptable in the food. Now, if an oil is heated twice before coming to the store, there are high chances that it will contain trans fat already. And then you will again heat it when you cook. So, yes, cold pressed theoretically is better than the refined oil that way. But again, it will not, any oil will not have fibers. And fibers are the prebiotic for your microbiomes. And that microbiomes is helping you to cure this disease, reverse most of the diseases or prevent the diseases. Okay. And the population of the microbiomes is 10 times more than your own human cells. The human cell total is about 30 trillions. And the microbiome population is 300 trillions. We are actually more of our microbes than the humans. Okay. So we have to nurture, take care of their taste also while we take care of our taste.
You know, I want to say this. I had stopped oil completely and I found that I was getting severe pain in my knees, which in any case I was getting slight pain. But when I stopped oil, not a drop of oil for 6 months at a time. And when I went back to my doctor, he said, you know, you need to have some lubrication. So he started me on a spoon of ghee with warm water in the night before I went to sleep. That worked like magic. So
there are ways to lubricate your joints. Yeah. If you eat nuts,
I do. I've been
The
eating
beauty-
nuts and seeds quite a bit. Avocados, walnuts.
so this is an anecdotal evidence. Okay. When it is 1%, it is called as anecdotal evidence. And when the evidence has to come from a group of people, yeah, the power of the study is good enough, we can accept that yes, it is good. If it is working, your doctor should go for a bigger study. And then if there is evidence, then we can follow that also.
One more thing is when it comes to medications, again, it must be holistic. Your aim is, of course, I know that knee pains are troublesome and you need to take care of that. You should always look out for alternatives because when you give something, it reduces your symptoms, but it increases other diseases like what Dr. Sharon showed. It comes with an additional disease, then you shouldn't be accepting that. Obey and convey the message.
Yeah, so that's why that limitation of 1 teaspoon a day with you balance it out. I got it. What you say.
So I wonder if you could do, instead of ghee, you could do a different oil. I mean, it's still oil, but it's better than ghee. You could do coconut oil or avocado oil or olive oil. Maybe that would help instead of you could try it. At least that's better than the animal based. Because, like he said, I mean, you have to worry about inflammation in other parts of your body too, even just a small amount. So maybe just try a different oil.
Yeah.
You can do that. Thank you.
In fact, I think applying the oil over your joint might help you much better.
What about B12? I mean, most vegans have a deficiency.
So they're going to have a talk tomorrow on B12.
What
Fully.
supplementation one should take?
Yeah, everything on that.
We'll have a half-an-hour session on that.
Yes. We hope to see everyone tomorrow as well. And I thank all the speakers. This has been a wonderful day for us. And the festival is still going on, of course. Those who want to enjoy some vegan food can just walk across and just a minute. For the speakers, we have some little token of appreciation. Request of Prabhu ma'am to hand over to Prabhu.